Hello, this is Vern Champagne, nurse practitioner, and I am speaking with you today about the Marburg Heart Score, which is a quality improvement project launched by myself and Dr. Kazabon for the Ochsner Center for Primary Care and Wellness. What is the Marburg Heart Score? It's a validated clinical decision rule, much like the Ottawa ankle rules or the Canadian CAT scan head rules. It's a 5-point yes or no scale with simple questions that gives an 89% sensitivity and a 64% specificity for chest pain of a cardiac etiology. Developed specifically for ruling out non-cardiac chest pain in the primary care setting. Why would we want to start using the Marburg Heart Score? Because anecdotally, as well as statistically, patients that we're sending to the emergency department for chest pain from primary care are being discharged later with negative troponins, showing that their chest pain is most likely due to a non-cardiac etiology. Secondarily, patients are being sent home without patient troponins, which at the same time are indicating the patient did have a cardiac etiology, and later having to have them turn around and go to the emergency department hours later. This will add evidentiary support to our clinical decision making, in the end hopefully decrease unnecessary ED utilization, and is to supplement our clinical decision making with actual evidence that we can demonstrate. The primary reason that we're undertaking this project is not only to satisfy my major requirement for my degree program, but also to improve patient care and overall system efficiency. How is the Marburg Heart Score used? Primarily, when the medical assistant or nurse enters the patient complaint, if there is anything in the ICD-9 grouping of chest pain, that will trigger the best practice advisory, or when the provider enters something in the ICD-9 diagnosis family of chest pain, that will also trigger the best practice advisory. The best practice advisory will show in the banner across the top of your Epic screen, and it will say BPA, or best practice advisory, with a number 1, 2, or 3 in parentheses. When you go to the planning section of the widescreen view, you'll see the hyperlink there that says Marburg Heart Score recommended, and you'll click to calculate the patient's Marburg Heart Score. When you click that, you'll be presented with the 5-question questionnaire, and you'll answer yes or no to each of the 5 questions represented. It will automatically total the tally at the bottom. If less than 2 is the total, then the patient represents a low risk of actual cardiac etiology for their chest pain. If it equals 3, it's an intermediate risk. If it's greater than or equal to 4, they are at high risk. As a final step, you should make sure to press the File button in the upper left-hand corner. That is what actually secures this document to the patient's record so that I can review it for statistical purposes and also to check the effectiveness of the Marburg Heart Score in patient care later. That's all you have to do. The Marburg Heart Score does become a permanent part of the patient record, and once again, this tool is to inform clinical practice but not override independent clinical decision making. There was an important question raised by Dr. Dillon during my presentation today, and that question was, what if the Marburg Heart Score is a number 5, but the patient does not look like they're having an MI? And my answer was this line right here, which is, if there's a difference between what you are seeing and what the Marburg Heart Score represents, then your clinical decision-making should be the overriding factor, not any information from the heart score, and your documentation should represent why there is a difference between the two. When will it be active? February 3rd, 2015, when you log into Epic, this should be active and working. We would like 100% compliance, although the N number that I'm requiring for a proper power for this study is quite low. This is a proven effective tool that can help improve patient care. So the more that we use it, the better our patient care will be, the more standardized our patient care will be. This reference will be included for your reading in the email that I will be sending out with this video link. And if you have any questions regarding the program or regarding the Marburg Heart Score, my number is 20393. My email address is vchampagne@ochsner.org. I hope you found this interesting, and I hope that you will engage with this quality improvement project, hopefully the first of many to come. Once again, my number is 20393, and my email address is vchampagne@ochsner.org. Thank you and have a nice day.